We didn't know what it was. We didn't know how it was going to work, and we didn't have a playbook. So my role was to make sure that our team and our community had the resources they needed to get through it.
We couldn't have done it without a community response. Absolutely not. Would have failed.
The Unified Command was a great way to coordinate and collaborate amongst all the different entities, the private clinics, Chief Andrew Isaac, FHP, but it was not usual in any sense of the word.
Seeing the community really come together, be supported by the mayor of the borough as well as the two city mayors, the commanding officers of the bases, and really allowing us to work with the community partners to respond was something that came together very quickly so that we could focus on the needs of the community.
The infectious aspect of COVID, the efficiency, the speed with which it can spread, and the novelty of it created a scenario where what we all did as individuals now impacted other people in a way that we just haven't seen before in my lifetime.
Fairbanks got hit hard and early and saw it fairly quickly spread and shared the information about how do we flatten the curve, what does this look like? And man, it was impressive to watch Fairbanks just very quickly be able to respond.
And maybe it forced not only us, but us with the borough and other partners in the city and others in the interior to really work closely together and see what is it that we can do in a situation where there is a pandemic and nobody really knows what tomorrow is going to bring.
Worked with community partners, including Foundation Health Partners, to put together a drive-through COVID testing site at the Carlson Center. We also did some mobile COVID testing sites around town to try and reach out to folks that didn't have the ability to make it to the Carlson Center.
Just allowing for some additional testing options in sort of some atypical sites. So it was a mobile testing unit. So it was public health really did a lot of work to spearhead that and set that up. And then we had the opportunity to volunteer to support that.
Working our way through the pandemic was very confusing, very scary. Rules were changing, the suggested guidelines were changing all the time, and having the partnership with Foundation Health Partners to help us understand what that meant, understand different data, how to read the charts, was incredibly helpful.
So I'd had multiple roles within the school district, whether it was talking with classrooms specifically, talking with teachers, talking with superintendents or principals, and talking with the school board.
Dr. Nace's unique ability to take complex information and unpack it so that everybody can understand it was invaluable to us. Not only was she able to help make things understandable, but she did so with such grace and humility.
I tried to put my best foot forward and to support where I felt we needed to go and what we had seen in the past, and to put that all together to help them process. But as far as pressure, absolutely, there was pressure, and I felt it.
Someone needed an ultra deep freezer to store the Pfizer vaccine. And so we kind of did that right at the get-go. So we had the infrastructure, we had the space within our pharmacy. And so that allowed us to, bring the vaccines in. We're having regular meetings with public health and all the people in the Fairbanks community.
And so we would meet and determine how the allocations were going to be spread around so it'd be fair. The whole thing encouraged a lot of community cooperation and participation.
Once we did have larger quantities, and the state said, next week, you need to open up a big clinic. and that was a little scary for all of us, but the Foundation Health Partners, they were great partners, and we worked together.
This was massive. We had a lot of vaccines to get in a lot of arms.
Our busiest day was over 1,000 vaccines that were given in one day.
I think one of the most gratifying things about the entire COVID experience was the community effort.
It was rewarding that everybody put their own personal interests aside, and we just did what we needed to do for the community.
I do think it has shown us as a community that when things are tight and when there is a really significant, challenging situation, that as a larger community, we get together, we come together.
And I think at the end of the day, Alaskans are here to support Alaskans, and you really got to see the partnerships and the different organizations working together, communicating together in ways that you may not have seen in another time period.
We established new relationships, and we had bridges, and we had connections that we had not fully explored before. And some of those connections remained in place to help for the betterment of our community.